Many commonly prescribed medications such as Metoprolol, Atenolol, Metformin, Statins, and PPIs are well documented to have tremendous potential for causing digestive problems and other side effects. But it never ceases to amaze me how few people are aware of this and how often doctors underestimate the potential for these side effects to be happening to you. In this video, I'll teach you about some of the most problematic meds when it comes to digestive symptoms and how to know if any of the medications you are taking could be causing your IBS or any other digestive problems or any other health problems that you might be having. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center. I've been really looking forward to making this video because I cannot emphasize enough the potential for medications to cause side effects. It literally blows my mind how many times patients have told me that the doctor who prescribed their medications either ignored them when they asked if that medication that they were on could be causing their symptoms, or gave them the impression that it couldn't possibly be causing their symptoms, or just flat out told them that their symptoms weren't caused by their medication. The potential for side effects for most medications is much higher and more common than you probably have any idea about, and this is such an important issue that you need to take charge and figure it out for yourself. So I'm going to teach you exactly how to do that. Now, some of the most troublesome medications in my clinical experience when it comes to things that can cause IBS and common digestive problems such as gas and bloating and diarrhea and constipation and abdominal pain and nausea and heartburn include the following: Metoprolol, Atenolol, other types of beta blockers, Metformin, statin drugs, PPIs, and antibiotics, of course. A lot of people assume that one. But those are just the most common ones. There are plenty of other medications that cause digestive problems and all kinds of other problems. Now, here's how to go about figuring out side effects that these and other meds can cause. Normally, you would just go online, right, and do a quick search. But when you do that for the side effects of medicine, you actually get a very abbreviated list that doesn't include the vast majority of possible side effects. And most search results aren't actually showing you anywhere near the complete list or even the most egregious side effects. So I'm going to show you exactly how this works. We're going to go online and do this. So let's look at two examples of exactly what I mean. All right, here's what I want you to do. Go open your favorite browser, right? In this case, it's Google I'm using here. And we're going to go into the browser and we're just going to type in Metoprolol side effects. And you can do this with any medication. It doesn't have to be Metoprolol. It could be another medication and you want to know what are the side effects. And so you type this in, right, and you get this list here that Google has pulled from the internet and is showing you all these interesting things like diarrhea and bloating and night blindness and all kinds of things that you could get from Metoprolol, but it's not all that detailed. You might think, wow, that's a lot of things and those look really bad. There are a lot more things that should be showing up here that are side effects of Metoprolol. And even if we click on the more, the 15 more, you get a few more things. Now this looks extensive. It looks like a lot. It looks like, wow, I don't want to have those things, but there's no context here. There's no idea of how common are these, and there's a whole lot more than this, believe it or not. So I'm going to show you how to find those because you can do it. There are a couple ways you can do it. We're just going to scroll down here because it's going to show up down here. What you do not want to do is go to these big name places like the NHS or the Mayo Clinic or the Cleveland Clinic. They're not going to tell you the details that you want. Where you're going to get those is right here on drugs.com. So you could have done that. You could have searched for drugs.com up here, but we're just going to use the link since it shows up here as drugs.com. And we're going to look at the side effects. what you might want to do when you search this in the future is just actually up here is type in drugs.com, and then it'll take you right to the link that you want, right? But I'm going to click on this one down here because it's here, and I wanted to show you what this looks like. So here we are in drugs.com. We're at the Metoprolol side effects. And Metoprolol is a medication for heart issues, for high blood pressure, and used for some other things. And so you're not all going to know about this particular drug, but you can do this with any drug. And what you'll see here is we're going to start scrolling down, and this is a really, really long page of side effects and warnings and all kinds of things. Now you're going to go, wow, well look at, there's these common side effects and there's these less common side effects, and you're thinking, well, that's really interesting, because it is really interesting, and there's a whole lot of things listed here, and you might want to read them, and that's fine, but it's a lot easier in this than this, and a lot more information if you keep scrolling. And then there's a section on rare, and you're like, well, I probably don't have those are rare. Well, maybe not, but keep going. Other side effects of metoprolol, and then they'll tell you some other things like belching and bloating and all this stuff. But keep going, because you can keep going down and keep going down. And this is the section that you want, is this section called For Healthcare Professionals, because actually that's where all the real stuff is. And you probably are the first one to ever look at this. Most healthcare professionals probably don't look at this, but because it would make their lives so much more complicated having to know all these things. But this is where you can start to break it down into systems, right? You get the cardiovascular system. They just give you some general stuff like fatigue and depression. Those are going to be listed probably further down as well. But here you can get systems. And so here's where all the side effects that affect the heart, affect the cardiovascular system are. They're all listed right here in this section. And they'll tell you what is the % chance that people get this who are taking this particular medication. So there's a very common section, there's a common section, there's an uncommon section. And look at this, very common means that 10% or more of people who take this medication can get heart failure, believe it or not. Hey, I don't make this stuff up. It's incredible, the numbers here. Up to 27% of people who take metoprolol experience heart failure. It's hard for me to even believe it, but there it is. I didn't write this. Hypotension means low blood pressure. All kinds of different things, right, that show up here that can happen as side effects of this medication. But we're really mostly interested in gastrointestinal side effects, because that's what we're focused on and talking about for this particular video. So look at this. The common gastrointestinal side effects of taking this medication called metoprolol, which is a super common med, by the way. There were over 65 million prescriptions for this last year. So there's a lot of people taking this, right? There are millions of people taking this medication. You have a up to 10% chance of getting diarrhea or constipation or nausea or gastric pain or gas, that's flatulence, or heartburn, or general abdominal pain or vomiting. So this medication has a very real chance of causing these symptoms. So if you're taking it, you have to wonder, you have to ask yourself, could it be the medication that I'm on that's causing my symptoms? And of course, that's something that we evaluate in our patients and that we look at as part of the big picture, because it certainly could be this. It doesn't guarantee that it's the medication, but it's certainly a possibility that you cannot ignore regardless of what your doctor says. And of course, this goes on and on, right? They have kind of their general other categories where they talk about fatigue and swelling and whatnot. They have a whole nervous system section where you get into all kinds of other interesting symptoms. There's a respiratory section. There's a skin, dermatologic section. There's a psychiatric section. So you'll get to see all of the potential side effects that could be caused by this medication. And these are known side effects, right? These are documented, researched. These are things that, these aren't just guesses. These are things that actually happen to people. Musculoskeletal side effects like muscle cramps and joint pains. That's what arthralgia is. Metabolic things like weight gain, right? All kinds. It goes on and on and on and on. and it's a really long list. But this is where you get the true details of a medication and what the side effects are that it could cause. And you need to know this because it's super important information if you're taking a medication. And this goes for any medication, right? No matter what medication you're on, you should be looking this stuff up. So let's look for another one. We won't leave drugs.com this time. We'll search within drugs.com. And you have to be a little careful when you do that because it's not super easy to get what you want. But let's look up Prilosec. So let's talk about a PPI. We'll just pick one called Prilosec. And we can either search Prilosec or we can search Prilosec side effects. I'll just search Prilosec really quick just to give you an idea of what happens in here. Prilosec advertises. Isn't that fun? You'll get a ton of ads in here, but that's all right. Just ignore them. And then there's a section on Prilosec. This looks a little bit strange, but you're going to want to click on this or click on the side effects thing, hyperlink here, right, to find what you want. So let's just click on Prilosec to give you an idea, and it'll tell you what it is and how it's dosed and all that. But click on the side effects link here to Prilosec. Now notice you're not getting all the details that we talked about that you want. You want more than this. This is not all the information about side effects for Prilosec. This is just the generic information. So you're going to want the really nitty-gritty information. That's what I meant about you can get sidetracked in here if you just click on, just do that, like on the med. You won't necessarily get what you want or what they have. You won't get everything they have. So I'm going to back up. I'm going to go back to that search that we did. Oh, come on, take me back. So we got to Prilosec, right? And I just clicked on that. Let's try Prilosec side effects and see if that gives us what we want. All right. So this is going to give us more detail. And we're going to scroll down. And this is where you're going to get the big long list like I was talking about for Prilosec, right? Or for a medication like I talked about for Metoprolol. So these are the, kind of the general side effects. They talk about rare side effects. They talk about incident unknown side effects where you just keep scrolling down, keep scrolling down. Oh, now it's less common. And there we are again, right? For healthcare professionals. That's what we want. We want that detail, not the stuff that they gave us up at the top where they gave us almost nothing. Here we are with the real symptoms. And we're going to scroll down, right? We've got a whole bunch of things here. Respiratory, nervous system. Notice they're not even in alphabetic order because here's gastrointestinal. And what is very common, meaning more than 10% of people who take Prilosec get diarrhea. Incredible. Up to 14% of people who take Prilosec, which is a super common medication, get diarrhea. I can't make this stuff up. It's unbelievable. Here it is. Common are abdominal pain and constipation and nausea and gas, right? Flatulence and vomiting. These are actually what they call common side effects of Prilosec. And that means up to 10% of people taking it. There are millions of people taking this medication. And then you've got other things, dry mouth, right, and candidiasis, and all kinds of interesting things that can happen when you're taking Prilosec. And that's just the gastrointestinal section. And, you can look at all the other sections, the dermatological and the musculoskeletal, and you name it. So this is something you want to do when you take a medication, is find out, wow, could it be causing any of my symptoms? Because your doctor is highly unlikely to know this or to give you this much detail or to look into this, even when you ask. When you ask them, is my medication causing these symptoms? And they'll usually say, no, that can't be it. But, sometimes they will know or will look. So you've got to look. You've got to be the one in charge and look and check all this stuff out. So this is drugs.com. Super simple website to remember, but not super simple to manage yourself within that site. Because as you noticed, you can get sidetracked to areas of drugs.com that won't tell you everything you're looking for. You want to get to this side effects section that has all this professional info, right? That's the section that took us down to for healthcare professionals. Amazing, right? And those were just two examples. I mean, we could literally just go on all day showing you examples of all the different side effects that all these different medications can have. But now you not only know the truth about the medications that you're taking, you are armed with the information that you need to take to your doctor when you are concerned that your meds might be causing your IBS or your other digestive problems, or really any symptoms that you might be having. And that's what you need to do, is actually go to your doctor and say, hey, is this causing this? I've seen this. I know it can. Let's figure it out. Now, that does not mean that your meds are always causing your IBS. We've seen lots and lots of patients taking these medications that I just mentioned and discovered that their IBS was being caused by something else and not their medications. So IBS is super complex and rarely easy, and it's why I encourage you to work specifically with an IBS specialist and not just a gastroenterologist. So if you need help sorting it out, give us a call at the IBS Treatment Center, because that's what we help people do. And we work with people all over the US and worldwide via telemedicine. So it's accessible for nearly everyone. Now, if you found this video helpful and useful, please give it a thumbs up and subscribe to my channel for more information about how to improve your digestion and your overall health. Thank you for watching, and have a healthy day.